Hi, my name is Jenna Burns. I'm currently a student in the vascular sonography program at Jackson College. So I wanted to share with you some challenges that I've had throughout the program and some study techniques that have worked for me. So something that I've had a hard time with is knowing how much I'm allowed to tell the patient. So we do lots of post-procedure scans at my clinical site. So the patients will always ask me how the vein looks and if the procedure was successful. And I've had a hard time learning how to speak to the patient in a way that it gets the point across that I can't tell them the results, but also so that they don't get nervous and think that something is wrong. And another thing is, so when I first started my clinicals, I had one clinical instructor, and then now I have 3. So something that I had a hard time with was getting used to having more than one clinical instructor, because they all would tell me different things and have me scan different ways. And so it was difficult for me to learn how to incorporate all of the things that they were telling me and figure out my own way that I like to scan. And also, okay, so it was I was set back for a long time because I had anxiety whenever I needed to talk to a patient, and that was a big deal for a long time. And I think it probably caused a lot of stress to my clinical instructors, and it was just something that I couldn't get past. And even to this day, it's still something that I struggle with. It's not quite as bad, but it's always there, and it's a daily struggle. Okay, so the way that I study that I found that works for me is that I read through the chapters in the book, and I read through the lecture notes, and I type what I read. I summarize it and I type it. And so I keep my notes on my computer instead of writing it on paper, because I would rather type it than write it out. But I do, I write stuff out on index cards if it's something that I think that I need to study a lot more. And I've also used Quizlet. I search for other people's sets, and I use them to review the subjects that I feel like I need more help in. And I've been using the vascular registry learning plan. I would recommend following that because it definitely, I feel like it's helping me get prepared for the registry. I haven't taken it yet, but I'm hoping that I will be prepared so that I can pass it. Okay, so just good luck with this program. It's very difficult. There will be lots of times when you have no idea what you're seeing on the screen, but just know that that's completely normal, and eventually it will come. There will be one day when things just click and make sense. So just hang in there, because that day whenever you do a scan and you don't need your clinical instructor's help is the best day. So you can do this. Thanks for watching my video.